What kind of treatment or kind of therapy are they receiving?
We treat their anxiety with anxiolytics and based on the National Institute for Clinical Excellence, we treat them with selective serotonin reuptake inhibitors. And psychologically, we give cognitive therapy and cognitive behavioral therapy. There's social treatment. We teach them how to reintegrate into the society, to understand that they are safe. We integrate both the family and the victims together to help them to re-socialize again. Then also, we teach them the aspect of positive psychology, aspect of resilience and coping.
What are the parents telling you about their children that some may not openly discuss with you?
For some that their children have been rescued, they blame the government entirely for the insecurity. Some of them blame themselves on not giving their children adequate security. For some that the children have not been rescued, they come with serious problem about what they experience and the fear of the outcome of their children. Those are the major complaints we get from these parents.
Does the country have enough social services to provide counseling for these students?
I would say we are in a country where the people that will offer these services are not adequate. We are in a country with over 200 million people, with a very few number of psychiatrists or people in mental health in general, with less than 200 specialists in mental health. So the workload is too much. So it's just like people that are privileged that will have these services.
Doctor, what are the long-term effects of these kidnappings for Nigerian students and the
Yes.
community?
The long-term effects will include, for older age group, enduring personality change following catastrophic experience, where somebody will have mistrust for the whole of the society, anger for the society, irritability, and in fact social withdrawal. And this, even though is a clinical diagnosis that has to be done after 2 years of the experience or of the symptoms. Then post-traumatic stress disorder, major depression, and anxiety, which can be recurrent.
And the question I believe most of them are asking, will they ever recover?
Yes, that's a question they always ask, but it's a very difficult question for every clinician. We can only assure them of getting well in the short term. But we have to be honest with them that the condition has a chronic cost with a lot of occurrences, especially those with anxiety disorders and major depression.
Dr. Haruna, how has this impacted the health sector in Nigeria?
Presently, the Association of Resident Doctors in Nigeria, National Association of Resident Doctors, are even on strike because of a lot of issue with the health sector. So people want to come into these programs. People want to stay in the country to help the country, but the government is not doing well. They are not helping them to solve their immediate problems. So if the government will help with all the demands of these health workers, people will come in and they will be ready to work, and people will be ready to come in to help people with these problems and the country at large.
How has that impacted you as a person?
Many people live in Nigeria to work elsewhere. I already made up my mind. I'll go out, improve on what I'm doing, come back to continue. It's really painful. I want the government to please do something, particularly with security, with the health sector. They should please listen to us. They should feel the pain people are feeling. It's really painful. I have never, no matter the level of physical pain, you never will see somebody in any form of physical pain wishing to die or to commit suicide. But mental pain, emotional pain It's really painful. Please let them know this. They should employ more people into the security agencies. More, our military is inadequate. They should our police force, other security, we are grossly inadequate. Encourage them to provide the security. So also the health sector as well is a mess. They should help us. They should listen to the health personnel so that we have the strength to impact on the lives of these people.